Chlorthalidone, also known as Thalitone 15 mg tablet, is a diuretic that is used to treat high blood pressure. This medication helps to prevent strokes, heart attacks, and kidney problems by lowering high blood pressure. It also reduces extra salt and water in the body, which can be caused by conditions such as heart failure, liver disease, and kidney disease. By decreasing the extra salt and water in the body, it helps to decrease swelling, edema, and breathing problems caused by fluid in the lungs. Thalitone works by increasing the amount of urine you make, especially when you first start taking the medication. It also helps to relax the blood vessels so that blood can flow more easily. It is important to take this medication as directed by your doctor and to take it at the same time each day. When taking Thalitone 15 mg tablet diuretics, it's important to take it with food as directed by your doctor, usually once daily in the morning. It's best to avoid taking this medication within 4 hours of your bedtime to avoid having to get up to urinate. The dosage will be based on your medical condition and response to treatment. It is important to use this medication regularly to get the most benefit from it. To help you remember, take it at the same time each day. Keep taking this medication even if you feel well, as most people with high blood pressure do not feel sick. If you also take certain drugs to lower your cholesterol, such as cholestyramine or cholestyramine, make sure to take this product at least 2 hours before or at least 4 hours after these medications. Remember to consult your doctor if you have any questions about your dosing schedule, and also tell your doctor if your condition does not improve or if it worsens. Some common side effects of Thalitone 15 mg tablet diuretics include dizziness, lightheadedness, and stomach upset. If these effects persist or worsen, it's important to notify your doctor or pharmacist. To reduce the risk of dizziness and lightheadedness, make sure to get up slowly when transitioning from a sitting or lying position. It's essential to remember that this medication has been prescribed because your doctor has determined that the benefits outweigh the potential side effects. Many people using this medication do not experience serious side effects. However, this medication may lead to dehydration and electrolyte imbalance. If you experience symptoms such as extreme thirst, very dry mouth, muscle cramps, weakness, fast/irregular heartbeat, or confusion, it's important to inform your doctor immediately. Additionally, serious side effects such as fainting, toe/joint pain, or signs of kidney problems should be reported to your doctor right away. In the rare event of a serious allergic reaction, seek medical help immediately if you notice symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects not listed above. Remember to always consult your doctor for medical advice about side effects. Before taking Thalitone 15 mg tablet diuretics, make sure to inform your doctor or pharmacist about any allergies you may have. This medication may contain inactive ingredients that can cause allergic reactions or other issues. It's important to discuss this with your pharmacist for more details. Prior to using this medication, it's crucial to disclose your medical history to your doctor or pharmacist, especially if you have kidney disease, liver disease, gout, lupus, or untreated mineral imbalance such as low potassium. Thalitone 15 mg tablet diuretics may cause dizziness. Avoid alcohol or marijuana as they can intensify this effect. Refrain from driving, using machinery, or engaging in activities that require alertness until you can do so safely. Limit your alcohol intake and consult your doctor if you are using marijuana. Excessive sweating, diarrhea, or vomiting can lead to dehydration, increasing the risk of dizziness or lightheadedness. Inform your doctor if you experience prolonged diarrhea or vomiting and make sure to drink enough fluids unless directed otherwise by your doctor. Before undergoing surgery, it's important to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you have diabetes, Thalitone 15 mg tablet diuretics may affect your blood sugar levels. Monitor your blood sugar regularly and discuss the results with your doctor. Notify your doctor immediately if you experience symptoms of high blood sugar, such as increased thirst or urination. This medication may also reduce the potassium levels in your blood. Consult your doctor about adding potassium to your diet, and they may prescribe a potassium supplement. Be aware that Thalitone 15 mg tablet diuretics may make you more sensitive to the sun. Limit your time in the sun, avoid tanning booths and sun lamps, and use sunscreen and protective clothing when outdoors. Notify your doctor if you get sunburned or experience skin blisters or redness. Older adults may be more sensitive to the side effects of this medication, especially dizziness. If you are pregnant, use this medication only when clearly needed and discuss the risks and benefits with your doctor. Additionally, consult your doctor before breastfeeding while using this medication. It's important to be aware of potential drug interactions that could affect how Thalitone 15 mg tablet diuretics work or increase the risk of serious side effects. Make sure to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Always consult with your doctor before starting, stopping, or changing the dosage of any medicines. Some products that may interact with this drug include dofetilide and lithium. Additionally, some products may contain ingredients that could raise your blood pressure or worsen your heart failure. It's important to inform your pharmacist about all the products you are using and ask for guidance on how to use them safely, especially cough and cold products, diet aids, or NSAIDs such as ibuprofen/naproxen. Thalitone 15 mg tablet diuretics may also interfere with certain lab tests, potentially causing false test results. Make sure to inform lab personnel and all your doctors that you are using this medication. If someone has taken too much Thalitone 15 mg tablet diuretics and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. You can call 911 or your local poison control center at 1-800-222-1222 for assistance. Symptoms of overdose may include severe dizziness and fainting. It's crucial to get help as soon as possible in these situations. Do not share this medication with others. It is important to make lifestyle changes that may help this medication work better, such as stress reduction programs, exercise, and dietary changes. Talk to your doctor or pharmacist about lifestyle changes that might benefit you. You may need to have lab and/or medical tests, including kidney function, blood mineral levels such as potassium, done while you are taking this medication. It's important to keep all medical and lab appointments. Consult your doctor for more details. It's also important to check your blood pressure regularly while taking this medication. Learn how to monitor your own blood pressure at home, and share the results with your doctor. If you happen to forget to take a dose of Thalitone 15 mg tablet, take it as soon as you remember. However, if it is close to the time for your next dose, then it's best to just skip the missed dose and take the next one at your regular scheduled time. It's important not to take a double dose to make up for the missed one. Remember to store Thalitone 15 mg tablet diuretics at room temperature and away from light and moisture. It's important to keep it in a safe place where children and pets can't reach it. When it comes to getting rid of any leftover medication, don't flush it down the toilet or pour it into a drain unless you're told to do so. Instead, consult your pharmacist or local waste disposal company to find out the best way to properly discard it. And always make sure to get rid of it when it's expired or no longer needed. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.